Right now, someone is mixing a glass of wine with their evening medication, and they have no idea it could stop their heart. This isn't fear-mongering. This is a documented medical reality that kills thousands of people every single year. Why does nobody talk about this? Because pharmaceutical warnings get buried in tiny print nobody reads. Today, in breaking down 10 common medications that turn deadly the moment alcohol enters your bloodstream, and some of these might be sitting in your medicine cabinet right now. Before we dive in, understand something crucial. Alcohol doesn't just add to a medication's effect. It multiplies it, twists it, and sometimes creates an entirely new toxic reaction inside your body. Your liver can only process so much at once, and when it's forced to handle both alcohol and medication simultaneously, something has to give. Often, that something is your health, or worse, your life. Let's start with the most obviously dangerous category. Opioid painkillers, including oxycodone, hydrocodone, and morphine, are prescribed to millions of Americans every year for pain management. These drugs already suppress your central nervous system and slow your breathing. Add alcohol to the mix, and that suppression becomes exponentially stronger. Here's where it gets terrifying. People have gone to sleep after a few drinks and a single pain pill, never waking up again. Their breathing simply stopped. The combination doesn't need to involve excessive drinking either. Even moderate alcohol consumption with prescribed opioid doses has caused fatal respiratory depression in otherwise healthy adults. Now let's talk about benzodiazepines, drugs like Xanax, Valium, and Ativan. These medications treat anxiety and panic disorders by calming your nervous system. Sounds helpful, right? But alcohol works on the exact same brain receptors, and combining them creates a sedative effect that can be impossible to predict. You might be wondering how dangerous this really gets. Consider this: benzodiazepine and alcohol combinations account for a significant percentage of emergency room visits related to drug interactions. Users report extreme drowsiness, memory blackouts, and in severe cases, coma. The scary part is that people often don't realize how impaired they've become until it's too late to seek help. Moving on to something many people don't consider dangerous at all. Certain antidepressants, particularly older MAOIs and even some newer SSRIs, react violently with alcohol. This is the critical part everyone misses. MAOIs combined with alcohol, especially wine and beer containing tyramine, can trigger dangerous spikes in blood pressure. With SSRIs like sertraline or fluoxetine, the danger looks different but remains serious. Alcohol can worsen depression symptoms while simultaneously reducing the medication's effectiveness. Some people experience increased suicidal thoughts when combining antidepressants with regular drinking. This combination doesn't just weaken your treatment. It can actively work against your mental health recovery. But wait, there's more, and this one surprises almost everyone. Acetaminophen, the active ingredient in Tylenol, seems completely harmless. It's available over the counter without any prescription required. Yet mixing it with alcohol creates one of the most severe risks to your liver that exists in common medicine. Both alcohol and acetaminophen get processed through your liver using the same metabolic pathway. When you combine them, your liver becomes overwhelmed trying to break down both substances. This creates a toxic byproduct that can cause irreversible liver damage or acute liver failure. People who regularly drink and take Tylenol for hangover headaches are essentially poisoning their own liver without realizing it. Let's shift to blood thinners now, specifically warfarin, which millions of people take to prevent dangerous blood clots. Alcohol interferes directly with how your liver metabolizes this medication. Drink occasionally, and warfarin's blood-thinning effect can become unpredictable, sometimes too strong, sometimes too weak. Why does this matter so much? Because too much thinning means uncontrolled internal bleeding from even minor injuries. Too little thinning means your original clotting risk returns, potentially causing a stroke or heart attack. Regular drinkers on warfarin require constant blood monitoring specifically because alcohol makes the medication's behavior so inconsistent. Here's a combination that catches people completely off guard. Metronidazole, a common antibiotic prescribed for various infections, causes what doctors call a disulfiram-like reaction when mixed with alcohol. This isn't a mild side effect. We're talking severe vomiting, intense headaches, rapid heartbeat, and flushing that can feel like a genuine medical emergency. This reaction happens because metronidazole blocks an enzyme your body needs to properly break down alcohol. The result is a buildup of toxic acetaldehyde in your bloodstream. Doctors specifically warn patients to avoid alcohol entirely during treatment and for several days afterward. Many people ignore this warning, assuming one drink couldn't possibly cause problems, and end up in urgent care. Diabetes medications present another underappreciated danger zone. Drugs like metformin and insulin work to lower your blood sugar levels. Alcohol also lowers blood sugar, sometimes dramatically, especially when consumed on an empty stomach. Combine the two, and you're looking at a serious risk of severe hypoglycemia. Symptoms of this dangerous blood sugar crash include confusion, slurred speech, and loss of consciousness, symptoms that can easily be mistaken for simple drunkenness. This is exactly why it's so dangerous. Friends and family might not recognize a diabetic emergency happening right in front of them, assuming the person has simply had too much to drink. Antihistamines deserve mention too, particularly older options like Benadryl. These allergy medications already cause significant drowsiness on their own. Alcohol intensifies this sedative effect substantially, impairing coordination, reaction time, and judgment far beyond what either substance would cause alone. This combination becomes especially dangerous when people drive or operate machinery, believing they're only mildly affected. Studies have shown that antihistamine and alcohol combinations impair driving ability similarly to being legally intoxicated, even when blood alcohol content alone would be under the legal limit. It's a hidden risk that catches many people completely by surprise. Blood pressure medications round out our list with a combination that causes sudden, dangerous drops in blood pressure. Alcohol naturally lowers blood pressure temporarily, and when combined with medications designed to do the same thing, the effect can become severe. This leads to dizziness, fainting, and in some cases, dangerous falls. Older adults face particularly high risk here. A sudden blood pressure drop combined with alcohol's balance impairing effects has caused countless falls resulting in broken hips and head injuries. What seems like a harmless evening cocktail can become a trip to the emergency room within minutes. Finally, let's address sleep medications like Ambien and Lunesta, drugs specifically designed to slow your brain activity for sleep. Combining these with alcohol creates a profound sedative effect that goes beyond normal drowsiness. Users have reported sleepwalking, sleep driving, and complete memory blackouts after mixing these substances. The FDA has documented numerous cases where people engaged in complex activities while under the influence of this combination, with zero memory of it afterward. This isn't just embarrassing. It's genuinely dangerous, as people have injured themselves or others during these alcohol medication-induced episodes without any conscious awareness of their actions. So what should you actually do with all this information? First, always read medication labels carefully, and never assume a warning doesn't apply to your situation. Second, ask your pharmacist directly about alcohol interactions whenever you receive a new prescription. They deal with these questions constantly and can give you specific, personalized guidance. Third, remember that timing matters too. Some interactions occur even if you drink hours before or after taking medication, not just simultaneously. Your body's metabolism doesn't follow a strict schedule, and residual effects can linger longer than you'd expect. The bottom line here is simple but important. These 10 combinations represent real, documented dangers that affect real people every single day. This isn't about scaring you away from necessary medication or demonizing alcohol entirely. It's about awareness, because informed decisions save lives. Talk to your doctor, read your labels, and never assume that just because a drink seems small, the risk is small too.